This is Scott Becker with the Becker's Healthcare Becker Private Equity Podcast. I'm thrilled today to be joined by a brilliant both entrepreneur and investor. We're joined today by Julie Yu. Julie's general partner at Andreessen Horowitz, A16Z. She works in biotech, healthcare, some other interesting areas. And I'd love to visit with Julie to hear about what trends she's watching, where she's most focused, and a lot more. Julie, can you take a moment and introduce yourself to the audience?
Thanks so much for having me back again, Scott. My name is Julie Yu. I'm a general partner at Andreessen Horowitz on our bio and health team, helping lead our investments into companies that are leveraging technology to transform our healthcare system. And as you alluded to, I joined the firm about 5 years ago after a journey as an entrepreneur in the health tech space. Was a co-founder of a company called Kairos, where we had the opportunity to work with a number of large health systems and payers in the universe that you spend a lot of your time in, Scott, and then made my way onto the investment side to head up the platform here.
Thank you. When you think about the different areas within healthcare, biotech, health tech, AI, traditional provider sides, where are you most focused and what's interesting to you today?
Yeah, I mean, we have a very broad mandate. So our fund covers both the life sciences side, so the bio side, as you say, which is really companies that are leveraging both technology and engineering-based approaches to transforming the way that we develop and discover drugs. Lots of incredibly just mind-blowing innovations and advancements that we're making there to both treat disease, but also in some cases cure disease, which is so remarkable. And then on the other side of our bio and health house, it's really health tech and digital health, which really covers the full gamut. I think that my background is more on the enterprise software side of things, and so I would call it roughly 60% of our portfolio is some sort of horizontal technology platform that is transforming the infrastructure layer of healthcare and care delivery. And those could be companies in the revenue cycle payment space, companies that are sort of operating at the data interoperability layer, companies that are providing tooling to frontline clinicians to transform the way that clinical care is delivered. So that's sort of many of the companies focused in that domain. But then we also have companies that are full stack in nature, as we call it. So companies that actually deliver healthcare services to patients, to members in the form of an actual provider group or a payvider in certain cases. And when we look at those kinds of businesses, we truly invest in them because at the end of the day, internally, they are tech companies. These are tech native businesses that are in some way, shape, or form leveraging software, AI, to build not just traditional care models that have a technology sort of wrapper to them, but in many cases actually creating entirely new care models that might be very challenging to deliver in a non-tech enabled world. And they're doing it with far superior unit economics. Their cost structures are fundamentally different than traditional providers and payviders. Their ability to scale nationally is far more rapid and nimble and efficient than any of their traditional non-tech native peers. And I think that is certainly, I think, ties into one of the trends that we're watching. It feels like maybe the last time you and I spoke, Scott, in the last couple of years, it was really the hospital systems that were in a world of hurt, right? We had huge financial stress on the provider side of the market. And, this just in the last, couple quarters alone, I think we're now seeing sort of equal degrees of pain on the payer and provider side, especially, with respect to Medicare Advantage and some of the headwinds there. But I think in both cases, one of the biggest sources of drag right now is just the sheer untenable cost structure of our care delivery system. And when the cost structure of our care system is so bloated, your margins are so thin, you're predominantly relying on human labor, versus sort of higher leverage mechanisms like software-based automation or AI. You're just less resilient to fluctuations in revenue or just other business dynamics. And, I think that's where you start to see, now that we have some very scaled digital health companies that are out there now, these companies that have far lower cost structures, rely less on, solely human labor. and just overall have more agility, you're really seeing those companies be able to weather the storm with just a lot more poise because they have so much more flexibility and elasticity in their operating models to be able to sort of take those blows without totally crippling their business model.
And let me ask you a question. You mentioned sort of the labor-intensive companies, and I'll talk about recently slowed down efforts or abandoned efforts by the Walgreens of the world, the CVSs of the world, the Walmarts of the world, to try and staff fully sort of primary care clinics across the country, which it just seems an impossible task given the shortage of doctors and so forth. How should people be thinking about labor issues? If you're a health system, how do you think about this mix of technology and labor and trying to run businesses that at one time were so reliant on labor, but it's expensive and but still very needed? How do you sort of think about these things from a health system perspective, or this what was thought of as some of the disruptors' perspective, but have found just they can't find the labor to actually disrupt how they wanted to? Any thoughts there?
Yeah, no, I mean, this is the question that I think our entire industry is grappling with right now is how to solve that. I mean, I think generally speaking, there's two vectors, right? So there's how do you enable the existing providers in the system to do better work and just have more leverage? And so, and this is actually where I think we've seen a preponderance of AI make a real difference, in enabling automation of tasks that, shouldn't otherwise be taking the sort of precious, mind share of whether it be clinical staff or even administrative staff, and just using software technology to drive efficiencies there. And so kind of leverage of existing providers is one way to think about it. And then there's the augmentation of existing staff. So how do you actually enable staff to grow, not just by virtue of human staff, but really technology-based staff? And we've seen a number of companies sort of package their solutions in that way, where they say you can actually staff an AI task worker that can sit alongside the humans and have oversight by the humans, by the way, as well, but actually perform full stack jobs that otherwise would be done in a very rote fashion by some highly trained human who has many other things that they could be doing with their skill set and their time and their efforts. And I think the other benefit of both of those vectors is just the sheer kind of satisfaction and kind of addressing the burnout issue. And the one sort of example that I would highlight that has been kind of all the rage in the last few months is the ambient scribing tools. I'm sure, Scott, you might have seen some demos and have heard some of the anecdotes about these tools. I have never in my career heard clinicians speak so positively about any piece of technology as they do when it comes to these ambient scribe tools that just are magical, right? And they not only actually do the job that otherwise either human scribes are doing, or that take away from the clinician's time during the day where they're going in and having to do manual notes, but they also just make it sort of enjoyable to do their job. It's really a delight for them to have such a magical tool in their hands that they can use in their everyday workflows. So I think we're already starting to see a number of those types of examples. Now, I'll end this portion of our conversation with a provocative statement, which is, and this is actually a quote that I heard from one team of hospital executives, where they acknowledge that in many cases, the teams or departments or service lines that could actually benefit the most from AI and technology tools are the ones who can afford it the least. And you see examples like this in the hospital setting where radiology departments are obviously at the tip of the spear of adoption of AI tools and automation tools, and that's because they have great margins and that's a profitable service line. But areas like primary care are the ones that have thinner margins, have much more constrained economic structure, who are least able to afford these new tools, but could potentially benefit from it the most. So I think we're probably going to have to start to see some novel ways to think about budgets and how to sort of spread the ability to pay for these tools across different areas of our healthcare system in a way that might upturn the behaviors that we've had historically, but will be a necessary way that we need to think about being able to take advantage of these new ways of technology.
Thank you. And take a moment there, because you've got this fascinating situation going on. And I'll talk about the health system world for a second. I saw today Advent Health building a new $400 million hospital. And that's not, Advent's a great system, but they're also one of the nation's healthy systems and can afford to invest, both aside from bricks and mortar, they could also afford to invest in technology and labor. In contrast, you've got a whole number of smaller systems that have no ability to afford the types of investments that might be needed. And they are often, just like you say about different service lines, they're often the hospitals, the health systems that can most benefit if they could automate stuff and change their cost structures. How do you think about it from a technology company perspective? Because you're an investor in a number of technology companies. How do you think about your market and who your companies focus on selling to and working with? And probably more importantly, how should the health system think about technology partners?
Yeah, I mean, this is actually the promise of technology, is the ability to serve the severely underserved markets in a way that wasn't possible if you only had sort of human labor at your disposal. And so I actually get excited. One of the trends that we are seeing in the market, Scott, is that you're starting to see historically, I think in like the healthcare IT world and kind of the early eras of digital health, you saw a lot of most of the activity coalescing around large health systems, large, national payers, larger regional payers, things of that sort, because to your point, they just had not only the budgets, but, just the scale of business where a company could, gain traction that would enable funding to occur, right? We need to underwrite to some degree of line of sight to repeatability in the distribution and go-to-market motion of these companies, and it's sometimes easier to see that when you are selling to large entities. However, in the last year or so, I think we've actually seen a pretty material shift in the center of gravity of where many of the startups are focused, in that many companies are now selling to independent practices, FQHCs, these sort of long tail of clinics that have been historically fairly, forgotten by many of the most leading edge technology innovations. And now we're seeing that because not only the cost structure of the technology solutions is low enough that you can package them in a way that's affordable, but really that the cost of the technology itself, right? I mean, the curve of even AI tools and what you're seeing with Gen AI, the ability to spin up a fairly robust set of capabilities off the shelf by using these foundational models and doing some light wrapping and training that's domain specific, you can really spin up some remarkable packages of capabilities in a very cost-effective way that can serve a fairly substantive amount of the workflow of these smaller organizations at a low price point. And so I think that's one of the biggest transformations that we've seen now in kind of the go-to-market strategies of many of these startups, is that all of a sudden the long tail markets are much more attractive because the economics have flipped, such that it is cost effective to deploy these very, very modern and cutting edge technology tools to the most underserved sides of the market.
Thank you. What you say resonates so well. It's certainly the transformation that's happened in financial services, where at one time only the Merrill Lynches of the world, the huge brokerage firms of the world could do certain things, and the technology made it much easier to be smaller, more nimble, more agile, and so forth, in a way that just wasn't possible even 5-10 years ago. Talk for a second on the biotech side. What do you see that you're most excited about from the biotech perspective? Because I think all of us, whether health systems, investors, everybody, consumers, patients, find the evolution of biotech to be so interesting and so important. I mean, obviously the things, the broad things like the Ozempics of the world, that was such a big impact, cancer treatments and so forth. Where are you most excited on the biotech side? What interests you?
Yeah, I think what you just described is one of the areas that we're spending a lot of time, is sort of these, quote unquote, miracle drugs, whether it be GLP-1s, and, miracle in the sense that the number of sort of indications against which that drug is showing impact, and really big, population scale, conditions in the cardiometabolic space more broadly, is just, the impact at the population scale is just huge. And same with, again, like cell and gene therapies, right? These entirely curative drugs that can, sort of transform the landscape of how certain patient populations are able to, frankly, just live longer lives, let alone in a healthy state. So, those are extremely exciting technology innovations on the biotech side. However, the challenge is obviously the only way that those drugs and therapies are going to be able to get into the hands of the patients who need them is that our healthcare system, and that's both a combination of the payment system on the payer side, as well as the care delivery system on the sort of delivery side, needs to figure out how to, number one, afford these drugs and pay for them in such a way that is sustainable. And, I would argue that today's payment rails are simply, the incentives are just not aligned in the way that it needs to be for these drugs to be made available to all the patients who need them. And we're already seeing that pressure, obviously, in the GLP-1 world, where any individual commercial plan who has an average span of membership of 3 to 4 years, because people are switching jobs all the time, doesn't have really any incentive to continue to pay for these drugs for the period of time that they're on their plan. And obviously even more egregiously so with these multi-million-dollar plus one and done therapies. And then even on the clinical logistics side, I mean, with cell and gene, we're seeing a tremendous number of hospital systems who are standing up centers of excellence, but having to build very bespoke processes, even in some cases, build very bespoke technology to be able to administer those highly logistically complex therapies. And so one of the areas that we're spending a lot of time, and we've written about this, is there a need and an opportunity for a new kind of business, shaped a little bit like a next-gen pharmacy benefit manager, perhaps, that is purpose-built for these kinds of products, that contemplates both a payment model that is sustainable and purpose-built, again, for these kinds of drugs and their pricing models, also provide services to the providers to enable them to absorb the capabilities and the competencies necessary to deliver these drugs safely to the patients who need them, and then partnership with the manufacturers to ensure that that end-to-end value chain is systematic and integrated. So, despite the fact that we have so many of these miraculous drugs coming to market, I think the kind of healthcare payment and delivery end of the stick, I think, has some shoring up to do before we're able to fully take advantage of them.
So let me ask you another question. You're one of the brightest people I get to visit with, one of the brightest people I know. Is there anything that has surprised you the last couple of years? What has sort of surprised you in healthcare, whether it's GLP-1s, those surprise you? Anything that the explosion of anything surprised you, or the challenge that Walgreens has had with Village MD, for example? They put $7 billion loss into this thing. What has surprised you in healthcare in the last few years? Anything that's top of mind?
Yeah, the one thing that comes to mind, Scott, is I'm surprised that it took us this long to realize the fragility of the infrastructure layer of our healthcare system. And of course, I'm referring to the very unfortunate recent events with the clearinghouse and Change Healthcare, and the outage that is now shining a light on the fact that we do have behind the scenes these sort of single points of failure that have either been, cobbled together through dozens of acquisitions that have never been truly integrated and streamlined, or that are just simply legacy technology that could be crumbling at the seams. And given my background and sort of the nature of companies that we like to invest in here, I think this is both, obviously a terrible and highly tragic set of incidents that occurred over the last few months that, really just brought certain systems down to their knees. But at the same time, the silver lining is that, I hope that there continues to be a lot of attention paid to what we need to do to modernize those layers of the stack finally, because, that's been the case for a long time. And it's just this unfortunate event that sort of caused people to realize how fragile that whole layer was. So I think that's probably one of the areas where I would have thought, sooner than later, that there would be some instance of something happening that would cause people to realize that it just came a few months ago. And I think now we're starting to see a lot of opportunity for whether it be the payments layer, whether it be the interoperability layer, even the clinical Rails layer for supporting frontline teams at the point of care. I think those are areas that in the next 3 to 5 years we'll finally start to see some real turnover in terms of upgrading those systems to be able to meet the needs of the modern universe.
I mean, it is so challenging how sprawling we are as a nation, how many certain things get so tied up in a couple single points of failure. I mean, you see that with some of the cybersecurity, the ransomware attacks, so many different things that just cause that to be very frightening. But let me ask you one last question, Julie. You know, everybody talks about AI today, and there are so many different AI vehicles and so many different meanings. How do you at Andreessen Horowitz, A16Z, think about AI and artificial intelligence today? And where do you see it? Is there clarity of the vision on it, or is it an evolving vision? How do you sort of see AI in healthcare and generally?
Yeah, I mean, listen, AI is a tool. It's a wonderful technology that enables what I'll call the scaling of judgment in many ways, and the ability to standardize the level of service that is being provided in a much more universal way versus relying on individual, people to kind of have to use their own individual judgment and cognition to try to reach the same end goal. But it's already ubiquitous. I think there's a lot of really interesting hand-wringing going on around our industry about what are we going to do about AI? What's our AI strategy? But the reality is that AI has been in use in clinical care for a long time, right? I mean, the thing that I always remind people is that we are perhaps the only industry that has actually had a regulatory framework for the approval of AI products for many, many years. And we have hundreds of AI products that have already been approved for use by the FDA, for use in clinical practice. And so in many ways, it's already out there. And not only in the clinical setting, but obviously the recent zeitgeist has been around how consumers are immediately adopting these new generative AI tools like ChatGPT and others to also inform their healthcare journeys. There was, those fascinating stories recently about, the mother whose child had some, sort of a set of symptoms that couldn't be diagnosed by doctors, by specialists for 3 years. And then all of a sudden she puts that into ChatGPT and gets what ultimately ends up being the right diagnosis, that the healthcare system wasn't able to come up with on its own. So you see all these, sort of more consumer driven versions of it, which I think is just a forcing factor to get the provider side of the market and even the payer side of the market to really wake up to the fact that this is inevitable. It's already here, and we already have the tools in play in many cases that we just need to think about how to expand some of those use cases, but also that we shouldn't run away from it. I think we've seen a lot of organizations in recent months say, hey, we're going to shut down access to all these tools. We're going to have sort of a no tolerance policy for the use of these new generative AI tools in their environments. I think that's just a road to failure because, again, it's kind of already out there.
Thank you very, very much. Julie, there's so much more I'd like to talk to you about, and maybe we'll save it for another time. Questions such as, what advice would you give to investors in healthcare and biotech? How would you look at this from a health system perspective? We've talked about some of that. There's so much to visit with you on. I'll let you go for the time being. I'll try and get you back on in not too long. Thank you so much for joining us on the podcast. Always a pleasure to visit with you. Again, Julie Yu, A16Z, one of the smartest people I get to visit with, and just an incredibly broad and nimble mind to go with just incredible intelligence and a wonderful entrepreneur and investor. Incredible. Thank you, Julie.
Thanks so much, Scott. It's always a pleasure.